Just get edged out, blacklisted, banned from his surgeries.
Blacklist. Blacklisted,
banned from his surgeries.
It can feel like we're carrying around a giant tumor.
When we walk in this door, you will maintain decorum. You will
Decorum. Decorum.
maintain decorum. You will.
Good morning, Annie. How are you? This is Dr. Bailey, and these are my fellow interns.
Dr. Krebs, we refer to patients as Mr.
Mr.
Dr. Krebs, we refer to patients as Mr.
Annie Connors is a 43-year-old woman who presented last night with progressive shortness of breath for the past 3 months.
Shortness.
Progressive shortness of breath for the past 3 months.
Almost did. Have you ever seen Alex like that? He actually seemed sincere.
Seemed being the operative word.
He was on.
Operative.
Seemed being the operative word.
He was on.
And I'll tell Bailey.
Mr. Harper had a coronary bypass yesterday. His blood.
Coronary.
Mr. Harper had a coronary bypass yesterday. His blood was running low overnight, down to 70 over 30, but responded to medication. Postoperative labs show crit of 30 and normal coagulation.
Coagulation.
Postoperative labs show crit of 30 and normal coagulation. Chest tube output has halted over the last 2 hours.
What's your plan?
Chest x-ray and check the tube for possible occlusion.
Good.
Occlusion.
X-ray and check the tube for possible occlusion.
Good.
Well, that's your name, right? It's on your jacket. Ah, fine, I'll just call you Bailey then.
You think you're charming and that talented neurotic.
Neurotic.
You think you're charming and that talented neurotic.
Ah, fine, I'll just call you Bailey then.
You think you're charming and that talented neurotic, overly moosed hair sort of way good for you.
Moose.
Overly moosed hair sort of way good for you. You don't scare me. Look, I'm not going to advertise your extracurricular activities with my intern. However,
Extracurricular.
extracurricular activities with my intern. However,
Poor thing, please. If you're afraid a doctor should take a pill. She's just sick. Like warped, you know?
Warp.
She's just sick. Like warped, you know?
The right hemidiaphragm diaphragm is so high that it's
Diaphragm.
right hemidiaphragm diaphragm is so high that it's right hemidiaphragm diaphragm is so high that it's completely displacing her lung tissue.
It's infiltrated her spinal canal in 3 places.
Infiltrate.
Infiltrated her spinal canal in 3 places.
you think she really wants to live? Come on. She's been housebound. She's been living.
Housebound.
Come on. She's been housebound. She's been living.
We're talking about a brain surgery that is performed while the patient is wide awake. There's a risk of paralysis, a risk of death.
Paralysis.
A risk of paralysis, a risk of death.
For a year and a half. A year and a half, and it's the first time she's even had it looked at. It's like she's fatally lazy.
Fatally.
She's fatally lazy.
Need to take a little blood. Dr. Burke is great. And Dr. Bailey. I know you're probably scared.
It's okay, kitten.
Kitten. Kitten.
I know you're probably scared.
It's okay, kitten.
Oh, I guess it's just like the elephant in the room.
Elephant?
I mean,
It's more like a giant sow, don't you think?
So.
More like a giant sow, don't you think?
It's just that he blatantly favors me in front of her, and then blatantly dismisses me.
How do you know?
Blatantly. Blatantly.
Blatantly dismisses me.
How do you know? Look, you've got a brain. You got into this program. Just because Shepard likes too much your cookie.
Munch. Munch.
Just because Shepard likes too much your cookie. Don't sit here.
You get to scrub in.
How psyched are you? On a scale of 1 to ecstatic? Ecstatic.
You know what I...
Ecstatic. Ecstatic.
Scale of 1 to ecstatic? Ecstatic.
You know what I...
There's a very small window of opportunity here. You know, once the Parkinson's progresses to a point of dementia, there's...
Dementia. Dementia.
You know, once the Parkinson's progresses to a point of dementia, there's...
Is that when you people will leave me the hell alone? What? Do I have to start drooling and forget my name to get...
Drool. Drool.
I have to start drooling and forget my name to get...
To hang another bag of on eggs.
Bunch here. Start with the distal side. Cauterizing the small bleeders to keep my vision.
Cauterize. Cauterize.
The small bleeders to keep my vision.
He was making waffles. I'm sorry? He was making waffles.
Waffle. Waffle.
He was making waffles. He was...
I was, I had an itch.
Itch. Itch.
I had an itch.
We're 22 and he has runs of VTech that I'm perfusing. CBT is sky high. Give him dopamine. 10 mics.
Dopamine. Dopamine.
Give him dopamine. 10 mics.
Okay, follow with suction.
How's it going?
It's more intertwined than the studies made it look.
Intertwine. Intertwine.
It's more intertwined than the studies made it look.
Looks like he's about to fall in.
Are you really as shallow and callous as you seem?
Callous. Callous.
Are you really as shallow and callous as you seem?
Go ahead, I got it.
We're okay here.
Book it. Yeah, I need some retraction.
Retraction. Retraction.
We're okay here.
Book it. Yeah, I need some retraction.
We can't pretend we haven't been told. We've all heard the proverbs.
Proverb. Proverb.
We've all heard the proverbs.
I've been holding up 50 pounds of tumor for the past 12 hours. My back's gonna need traction and the patient.
Traction. Traction.
Back's gonna need traction and the patient.
And that even the biggest failure, even the worst, most intractable mistake,
Intractable. Intractable.
even the worst, most intractable mistake